The relationship between a mother and her daughter is one of the most important and meaningful relationships a woman can have. Mothers and daughters are more than blood and DNA. They are bound by a special bond of love, care, and affection. They share a lifetime of memories and conversation. For a daughter, this relationship can be one of the most influential relationships in her entire life. What she learns from her mother can affect the decisions she makes in many areas of her adult life. Mothers are able to influence their daughters' eating habits, definitions of success and ambitions, and even personal values. One particularly important area of influence that has been understudied is how mothers affect their daughters' health decisions, especially in regards to women's health.
Women are seen as the health manager of the family. Since there is so much ambiguity and uncertainty around proper health information for women, and because a daughter will generally rely on her mother for information, it is important for a mother to properly provide correct information before it is needed. This can be done through self-disclosure or modeling behaviors. To study this influence, we asked how are daughters' self-disclosure and health-seeking behaviors shaped by mother-daughter communication about health. To answer our question, we conducted focus groups and an interview with college-age women from a large Midwestern university. These focus groups and interviews focused on the daughter's memory of how her mother acted towards health issues and how she communicated about it. We also included questions about specific women's health topics, and we explored the daughter's reactions to these different issues. After we conducted the focus groups and interviews, we transcribed each one and analyzed it for recurring topics and themes.
From our data, we discovered one overarching theme that answered how daughters' health behaviors were affected by mother-daughter health communication. We found that the mother's values played an important role in how information about health was shared with daughters. These values, whether religious or traditional, affected the tension between mothers and daughters. They would have to find a way to handle the tension between autonomy and connectedness. Mothers often wanted to be a part of their daughter's life and be connected, so they would share health experiences and information. Daughters fought to be more autonomous and handle their own health information without their mother's help. This theme affected the mother-daughter communication in 3 ways.
The first way included the uncertainty for both mothers and daughters about the topics they talk about and when to talk about it. Daughters whose mothers did not discuss women's health issues were uncertain about when to visit a doctor and were uncertain about what to expect at these appointments. Mothers were uncertain about what their daughters needed. Uncertainty was reduced when mothers and daughters shared the connection side of the tension and reciprocated disclosure.
The second way values and tension affected mother-daughter communication included the ritual of the talk about sex and reproductive health between mother and daughter. This time was awkward, unplanned, and dominated by the mother. However, there was a specific time and place the mother felt the daughter was old enough to know about these issues. This rite of passage could be rejected by the daughter. It could only occur when both the mother and daughter accepted it. The third issue that persisted in mother-daughter communication dealt with the separation of sexual health from other health. Mothers were confident in talking about exercise, eating habits, and other naturally non-sexual issues to encourage connection, but they had a difficult time discussing sexual health with their daughters. Rather than being a medical issue, sexual health was stigmatized and avoided according to values.
These different parts of how mothers and daughters communicate about health have consequences on the daughter's health behaviors. It is important to understand exactly how influential the mother-daughter relationship can be on the daughter. Mothers have the ability to influence positive and healthy health behaviors. She can also build connection with her daughter by self-disclosing information about women's health issues, especially her own. This, in turn, affects the daughter's self-disclosure to her mother as she feels more connected.
It is important to understand how mothers are so effective in influencing their daughters' behaviors. Mothers must learn to provide a safe time and place to talk about women's health issues, including sex, in order to build a connection with their daughters. By recognizing how their values affect their discussion of health topics, mothers can improve and alter their communication. In addition, health practitioners need to be aware of how daughters may not feel comfortable disclosing information about certain topics with their mothers. In the future, this can lead to a happier and healthier future for women's health.